Good evening. My name is Jennifer Lee. I'm the Chief Operating Officer with the Hanley Foundation. Our mission at the Hanley Foundation is to eliminate addiction through prevention, advocacy, treatment, and recovery support. Welcome to our first town hall session in our 2022 Recovery Leadership Institute series. Tonight, our topic is a practical overview of the neurobiology of addiction with Dr. John Dyben. We'll have a moderated Q&A following this session, the presentation, so be sure to put your questions in the chat. Thank you to our series community partners, Palm Beach County and Palm Beach County Community Services Department. Also, thank you to Origins Behavioral Healthcare as our host this evening. To learn more about Hanley Foundation initiatives and upcoming events, please visit hanleyfoundation.org. About our presenter, Dr. John Dyben. With his multifaceted experience and leadership in the substance use disorder treatment field, John's varied skill set includes counselor, clinical manager, teacher, pastor, respected expert. As Chief Clinical Officer, John provides supervisory and clinical oversight to all Origins behavioral health care programs. John continually builds upon his academic expertise through research and nationwide speaking engagements on addiction, spirituality, and related topics. He holds a bachelor's in psychology, master's in conflict management, master's in management, and a doctorate in health science. He's completed postgraduate studies in psychology, philosophy, and religion. He holds he's a master's certified addictions professional, certified mental health professional in Florida, internationally certified alcohol and drug counselor, and a substance abuse professional. John is also a musician, writer, and private pilot. He enjoys spending time with his family. And here's Dr. John Dyben.
Thanks, Jen, for the introduction. I appreciate it, and I want to welcome everybody who's here and welcome everybody who is viewing this from your home or your computer screen. Everyone, just want to say I'm very thankful for you being here tonight. We're going to talk about addiction, and the goal is to have a better understanding of what's happening in the brain and how that translates to the things that we see outside. When we think about addiction, when you ask people what their experience with addiction or what it is, when you ask lots of people, you're going to get lots of different answers. But ultimately, what our medical and healthcare and scientific communities tell us is that addiction is a disease. And I wonder, I always like when I talk to people about this, I ask you, and even you at home or wherever you're at looking at a computer, think of this, have you ever heard that idea that addiction is a disease? And have you ever yourself or seen somebody kind of roll their eyes and say, give me a break? And most of us have either been in that give me a break, it's not a disease kind of category, or known people who think that way. And so tonight, what I want to do is really understand, walk away with an understanding of what we mean when we're talking about addiction as a disease. So first when we think about this, to really get into it, we've got to talk about the way we use mood-altering substances just as a culture. And all of us have one of what I describe as one of 5 relationships with mood-altering substances, with drugs, including alcohol. We all have some relationship. Some people, your relationship with alcohol and other drugs is abstinence. I don't use, I eschew the use of any mood-altering substances. And there's different levels in there. Some people will say, I don't use drugs, I don't drink alcohol. If the doctor gives me a drug, I'll take it. Other people are very strict, and they won't take anything that is mood or mind-altering. But the bottom line is abstinence is people generally tend to stay away from it. Then you have the vast majority of American adults are in the substance use category. That means I might have wine with my dinner or beer with my pizza. I might use drugs legally. But the bottom line is that my use of mood-altering substances doesn't cause problems in my life. But then some people, their use of mood-altering substances is beginning to cause problems in their life. They haven't completely lost control, but they're starting to have problems that are due to substance use, and we call that abuse. Now, for those of you that are out there that might be clinicians or thinking about diagnostic terms, this idea of abstinence, use, abuse, and eventually we're going to talk about addiction, it's an older idea, but I really think it helps us to get a picture and a foundation of as we move into understanding what addiction is. So I'm still using this model. So abstinence is I stay away from it. Use is I use mood-altering substances, but it doesn't cause a problem in my life. Abuse, it's starting to cause problems in my life, but I can walk away from it. I can stop. I have power and control to change. But some people develop a condition that is called a severe substance use disorder, or most commonly we refer to it as addiction. And when addiction takes over, you have crossed from choice into a disease state. The brain literally makes changes that are really important to understand. The goal of tonight really is to understand what is it that happens in the brain. So when we talk about the neurobiology of addiction, even if you don't have any background in biology or the brain, we're going to kind of take it apart and really look at what happens in our brains when we develop addiction. Another way of, and I want to point out one more thing on the slide before we go, that there is this fifth one. There's what I call non-addiction dependence. So it is actually, we're going to talk about a symptom where people can become dependent on drugs. They need the drugs, and we're going to talk about that. And that is often a symptom associated with addiction, but it's not always addiction. So there are people, for example, if you talk to surgeons, and they'll talk about they have patients who have operations, and they have to be on, they put them on opioid pain medications post-surgery to deal with the pain. And they'll tell you that they'll say, I have, sometimes I'll have patients and their body will become dependent on it. That means that when we take them off the opiates, they will start to have withdrawal symptoms, negative symptoms, because the drug is being taken out of their body. And some patients will say, ugh, that was terrible. I hated that. Don't ever put me on that again. Other patients will say, this is uncomfortable. I need more opiates to stop this. And so we're going to talk about the difference between the fact that you can be dependent on a drug and it not necessarily always be addiction, because there's one real key to telling the difference between any of these other states and true addiction. And we'll talk about it in a moment. I like this illustration as well because it kind of gives a realistic picture. The majority of people in our nation, majority of adults, are substance users, and a high portion engage in what's called risky abuse. That means every once in a while they will binge drink, or they will drink more than they wanted, for example. But they don't develop problems. But some people who have risky substance use, well, they do. They develop some level of substance use disorder, and a small subset of those people, maybe 15%, depending on the drug, well, they develop what we're talking about tonight, which is addiction. So what is addiction? I love definitions. And forgive me, because we're gonna pull this definition apart. But it's a really great one, and it's really helpful for understanding it. So addiction, by definition, is a primary, chronic, neurobiologic disease with genetic, psychosocial, and environmental factors that influence its development and manifestation, and it's characterized by behaviors that include at least one of these: impaired control over use, compulsive use, continued use despite there being harm from it, and cravings. So taking this apart for a second, the bolded words are really important. What does it mean when our medical societies say that addiction is a primary disease? A primary disease is one that is not fixed by fixing other things. So a lot of times, if someone develops addiction, there will be this idea, you know, that this is really about depression, or it's really about anxiety, or it's really, and if we just deal with those things, that will fix the addiction. And if a person has gone into that true addictive state that we're going to talk about, it's not going to be fixed by fixing something else. It's a primary condition. The next is that it is a chronic condition, and this is a really important thing to understand, because we sometimes tend to treat it as if it's an acute condition. What is a chronic disease? I mean, think about diseases that are chronic versus diseases that are acute. Here's a good acute disease: influenza, the flu. When I get the flu, I get really sick, and I have this understood episode, and it has an expected length of time that it's going to start and it's going to stop. We know its course, and it's time limited. But if you think about diabetes, you think about coronary heart disease, there are conditions that follow a person for a long time, that are not, you can't just say they're going to be in this small given time frame and we can just treat this in the time frame and then it'll go away. Chronic diseases, and I really like diabetes, we're going to stick with diabetes for a while, they have to be managed over a long period of time. So it's primary, it's chronic, it's neurobiologic. That means this is a disease where the primary organ involved in the disease is the brain. This is a disease of the brain. Now, going back to those next bolded words, it has genetic, psychosocial, and environmental factors. It's really interesting. When people talk about addiction, a lot of times there's different opinions and different thoughts and feelings about why people become addicted. And it used to be theorized, it used to be theory, that there was a genetic component to addiction, that some people were more genetically predisposed to develop addiction than others. Think about it. Have you seen, can you imagine two people that, you know, maybe two friends in high school, John and Joe, you know, they maybe drink in high school, use some drugs in college, maybe even party a little too hard sometimes, but then they finish college, and John, you know, just keeps using, and it gets more and more and more, and he can't stop, and his life goes, you know, down the toilet. And Joe is like, no, I'm just going to stop. Why is it that one person continues and one person doesn't? And for a long time, it was theory that there was a genetic trait, that some people were more genetically prone to develop addiction. And the reason that that's not theory anymore is we know it. We know that is true. The evidence is really convincing that some people are simply more prone to develop addiction than others. But it's also environmental. So if a person who is genetically predisposed to develop addiction never is exposed to drugs of abuse, then it won't manifest itself. So the environment most certainly has something to do with it. And the psychosocial, what we know is that the course of addiction, both the likelihood that people will get into addiction and develop addiction, the course of it, as well as the likelihood that someone with it will get treated, will get help, is influenced by all the factors in their life, including societal factors. So if we live in a nation where high levels of substance use is normative and encouraged, and that's our norm, then it's more likely that we're going to see some people develop addiction. At the same time, the environment impacts and the stigma of addiction, the lack of understanding impacts in that it makes it less likely that people will be able to access help and care and treatment. So is it genetic? Yes. Is it environmental? Yes. And is it psychosocial? Absolutely. And we're going to talk about what these other words here are here. But the summary is this. Addiction is a chronic disease. It's characterized by impaired control over use. So that is that person who says, man, I really am tending to drink too much when I go out with my friends. I'm going to have no more than 3 drinks tonight. And they mean it. They're not lying. They really mean it. But once they start, they cannot stop. They have impaired control over use. And it's also that person who says, I swear I'll never drink again, I'll never use again. They mean it, but they go back. So impaired control, compulsive use and continued use despite harm and craving. Let's talk about some of those words. So we said when we were looking at the first definitions, so some of the things that are hints that we might be moving towards problems, so that someone is moving towards maybe risky use of substances, towards a more severe and even towards addiction. There are a few things that are key. The 2 big ones that we talk about a lot are tolerance and withdrawal. And before we're done tonight, we're going to talk about why tolerance happens, what happens in the brain that makes it happen. But when we talk about this word, what we're talking about is needing more and more of a substance to obtain the same result. And so I might say, man, I remember the first time I drank a beer, and it gave me a buzz, but soon it would take me 3 beers to get a buzz, and then 4, and then more and more. I remember working with a man who could drink a case at a time, and it wouldn't have any effect on him. This, whether it's alcohol, other drugs, whether it's prescription drugs, when I need more and more of a substance to get the same effect, that is tolerance. And along with tolerance, the other symptom the physiological symptom that we see a lot is something called withdrawal. So withdrawal is when if I stop taking the substance for long enough, and for some it's hours, some it's days, but my body has become so acclimated to having the substance on board that I will experience negative physical symptoms if I go off, if I stop taking the drug. This is a symptom of dependence. Remember, we talked about that dependence can be a symptom of addiction, but it's possible, again, to be dependent and not be addicted. There's a big one word that will help us understand the difference. So tolerance, needing more. Withdrawal is when I have those negative impacts. This is the word that is the differentiator. This is the number one most prominent symptom of addiction. It's called compulsivity. It is a constant drive. It is an intensive mental obsession to obtain the drug, or to use the drug, or to protect my ability to use the drug. And compulsivity actually is often paired with craving. So you'll hear people talk about compulsivity or compulsive behaviors and craving all the time. But I think that there are actually 2 really different things. The compulsivity is this it's mental. It is this internal process. So a person might say to me, they might say, John, I can't have an alcohol use disorder. I can't have alcoholism because here's my deal. I work from 9 to 5 every day, and I don't drink when I work. Now, I hit the bar at 5:01, and I go all night, and then I'm going all weekend. But come Monday morning, 9 a.m. to 5 p.m., I'm working and I don't drink. And the question is, what's on your mind from 9 a.m. to 4:59? And if a person has a substance use disorder, or especially if they have addiction, even if they're able to hold it off for a time, they're still going to have that compulsivity. Their mind is constantly focused on using or obtaining or protecting their ability to use. Cravings are the intense physical and emotional triggers to use. It's this drive. It's really, if anybody is a smoker, if anybody's ever quit smoking, with smokers, they talk about experiencing nicotine fits or nic fits, right? And it's this intense need for a cigarette or whatever they smoke, and this is craving. So these are symptoms altogether. These are symptoms that are consistent with, that are part of addictions. So we've got all these words, and I want you to think now, just set those aside, and I want you to get real practical, and I want you to think about your life. And I want to ask you this question: what matters to you? What's important to you? And when you think of it, here's our little bullseye. Put the most important things, put them in that yellow, right in the middle. I'm a family guy, right? I'm a dad, my kids are going right in the middle, right? And what's next level of importance, right? I'm passionate about my work. So my work's going to go in that next level of importance. And what's next after that? I really like my friends. And if you think about your own life and what matters to you, you can put these concentric circles, you can kind of picture what's important to you. And I bet that if you looked at your life, you would see that your time is spent in the most important places, that your investments are in the most important places. But here's what happens. Addiction eventually robs a person of all of that, so that the drug becomes the center. And this is not a function of someone becoming a bad person. This is a function of a change in the brain and a literal disease. So here's what's happening. So, and this is why I call it the stagecoach brain. So I always tell people, my father, both my parents are still alive today. My father they're in their 80s and living in North Florida and loving retirement. And my father is the most moral human being I've ever met in my life. He has more integrity than I've ever met in any human being in my life. Super honest guy. He's also, he's a scientist and an engineer. He's very intelligent. And he also was a fighter pilot. He flew F-100s in Vietnam and was a highly decorated veteran, combat veteran. And fighter pilots, I mean, you're talking about flying multi-million-dollar aircrafts. And so he's tough, and he's intelligent, and he's moral, and he's also just a good, caring human being. And here's what he told me one day. He said, I had to go through this training as jungle survival training. And as a part of this training, we had to go some ungodly number of hours without any liquid. Essentially what they did is they brought us to a point where we were close to dying of thirst. And he said, what I realized at that time is that I would have done anything to anyone. I would have lied, I would have stolen, I would have cheated, I would have done anything to get water. It's not because he was dumb, not because he was weak, not because he was immoral. He is none of those things. This is a function of the brain. And here's what we're talking about. So we don't need to worry about all the different pieces, but what's really important is understand. We're just going to talk about two main parts of the brain. We're going to talk about the midbrain. That's that big pink, that midsection in there and the things that surround that. And then what's called the prefrontal and the frontal cortex, where you see this judgment. And the brain is really, really interesting. That midbrain, our midbrain, is, and people refer to it as all sorts of different things. I used to call it lizard brain and different things in like 10th grade biology. But the bottom line is that your midbrain and those areas in there are involved in instinct. They are where your absolute instinct is. We tend to think that we are always in control of ourselves, that we are always making decisions about our behavior, but it's not true. When we are in a fright or a life or death situation, this part of our brain can take over. And the proof of it, I don't do this anymore, but what I used to do, until it really kind of freaked someone out once, a student, is I would be talking about this, giving this talk, and people would be maybe listening, maybe not, and I would say, you know, you're not always in control of your actions, and then I would suddenly slam my hand down or throw a book down or something that was shocking. And what happens? It would happen if we did it right now. Everybody would, you know, have this reaction, right? And so I would ask the students, so my goodness, you just had this reaction. What was the logical thinking that went into that? Did you look and see me throw the book and think logically, John just did something I don't understand. He's a little weird anyway, so I'm not sure if I'm in danger or not. So what I'm going to do is I'm going to tense my muscles so that I'm ready to fight if I need to, and I'm also going to bring them up and protect my most vulnerable areas. You're not thinking any of that, right? It's just instinct. There is no thought that goes into it. So when our brains are in a life and death situation, we are only on instinct. Because how the brain works, and this is how I think of it like a stagecoach, the midbrain is like the horses. It's raw power. But the frontal cortex is like the reins. And so you can probably, all of us can probably think of a time where I've had an impulse to do something, but I've been able to stop myself, right? Not that anybody here has road rage or anybody's ever experienced that, but I've heard that sometimes people driving on 95 will get cut off by someone and they'll just have this immediate action, like immediate feeling like I'm going to ram that guy, but then they stop themselves. That's the interaction between the midbrain and the frontal cortex. The midbrain is saying go, 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 and that prefrontal cortex is saying nope. That's not the right thing to do. And so that's how the brain works when we're in a state of health. But when we are in a life or death situation, for example, if I'm starving to death or if I'm about to die of thirst, I will do anything. What happens is the blood flow really, it stops, it decreases in those frontal areas, and it moves to the back of the brain and towards the middle of the brain. And so literally, it's kind of like you're taking the reins and you throw the reins off. Now, it's not a perfect analogy because people can still make choices. And in fact, family members who have loved ones who have struggled with addiction will say, you know, my loved one was very calculated in what they did. They weren't out of control. They knew exactly what they were doing. And that's how it looks from the outside. And I understand. And I've been there. And that is how it looks. What's important for us to understand is that what's really happening is though they have goal-directed behavior, their ability, when you develop addiction, your ability to change the focus of that goal-directed behavior, it is severely limited. It's actually a state where the ability to choose is diminished and sometimes almost completely. And a person's brain is telling them, you must get the drug or you will die. And so the brain of a person in active addiction looks not dissimilar to the brain of a person who is starving to death. And this is where that compulsivity comes from. And I know that it doesn't look that way from the outside. And that's why it's so important for us to understand this and to help people understand that what's happening is not just what it looks like. The reason this becomes really important, I remember years ago, I was talking to a group, a state group of therapists, and their state annual meeting. And there was a person who came up to me. She was a licensed clinical social worker. She had many years as a therapist, a very bright lady, and she said, I wish somebody had told me this. I've never heard this information. I didn't know this. I wish someone had told me a long time ago. And she told me her story. Her story is that she was married to the love of her life, her high school sweetheart. They were, best friends. He was a great husband. They had 2 or 3 kids, and these kids, he was a great father. And at some point, however it happened, he actually had some risky alcohol use, and then it moved and developed into addiction. And he ended up being this guy whose kids and family were the center of his world, and then maybe his job, and to where alcohol was everything. He eventually died from complications secondary to alcoholism. And she said, my kids, he died. She said he died 10 years ago. My kids are all adults now, but they've wondered for the past 10 years, how could Dad choose a drug over us? And what's important for her and for all of us to understand is that when we're talking about addiction, it's not about choice at that point anymore. So when we understand this, we can recognize that people with addiction are not bad people trying to get good, but they are people with an illness who need treatment and help and respect and mercy, just like anyone with any other disease. I said I like to talk about diabetes. The other great example, my mother was also a military officer. My parents met in the military. And my mom, I will tell you, is the toughest human being. She's also very moral and all those things. She's the toughest human being I've ever known. And I say that in a really good way. But my mom, in her diabetes, is all over my family. Both sets of my grandparents are diabetic. Aunts, uncles, cousins, all over the place. And we're all aware that diabetes is a chronic illness. We're all aware that there are genetic predispositions to diabetes. And so my mom, at some point, went to the VA, and the doctor said, looks like you've developed type 2 diabetes. But you know what? You're early on, and we can probably control it without medication if you change your diet and do some exercise and take care of yourself. 6 months later, my mom went back, and my mom was an educator and a social worker, and so she had not taken much care of herself. I know that's an overgeneralization, but she was one of those, takes care of everybody else, but not so much herself. And so she told me about the visit later, and she said, John, I went to the VA today for my 6-month follow-up, and the doctor, who was 12 years old, by the way, said to me, Mrs. Dyben, here's the deal. You have diabetes all over your family. You are genetically more likely, you're predisposed to develop this. You're not responsible for your genes. However, right now, you know that you have this, and we can either get it under control with these changes, or we can get you on medicine that I know you don't want to do. And here is her bottom line. You're not responsible for your disease, but you are responsible for your recovery. And so to say and understand that addiction is a disease is not saying, therefore, you have no responsibility in your life. Just like with my mom. She wasn't responsible for the condition, but she's responsible for what she did with it. And so what we need to do when people have this disease is provide treatment and help and support just like any other disease. I want to talk real quick before we end and before we open it up for questions, because we're going to open it up for questions in just a minute. But I told you that I would talk to you about why tolerance happens. And my brain works a little weird, so this really helps me. So I hope this will help you as well. Why is it that some people end up needing more and more and more of a drug? What happens differently in their brain? So I want you to look at this picture, and don't worry about all the specifics, but our body has these millions and millions and millions of neurons that run through it. And there are chemical transmitters that run through, and they regulate everything. They regulate our mood, they regulate our respiration, right? They regulate everything. Dopamine is a feel-good chemical. Most people have heard of it by now, or familiar with it, and there's others. But I want you to think of the brain like this. So there's all of these little nerves, or these, well, you know, I just lost the word. Live in a training, I lost the word. So there are these nerve cells that go all throughout the body, and think of it as like two cliffs with a valley in between. And that's what they are. They kind of meet together, and on one cliff where it says receptor, I want you to think of those receptors as baby birds. And they're just saying, feed me, feed me, feed me. And on the other is mama birds. And whenever there is a reason, there's a trigger, and there can be lots of trigger. You might feel sad, and you hug a friend, and you feel better. You get some dopamine. You might eat a piece of chocolate. You do something good for yourself. You get dopamine. And so the senders, the mama birds, send little worms of dopamine, and then the baby birds are happy. Can you imagine that? Can you picture that in your head? Now imagine that I, outside of this, have a huge bucket of worms and I throw it in there. What's going to happen? Well, first of all, the baby birds are going to feel really good. They're going to like it. But the other thing that's going to happen is, if you've ever fed birds anywhere, you know that you feed one and you start getting more and more. What happens in the brain of someone who becomes addicted is they actually activate more and more receptor sites. And what that does is that creates an additional need. So now I need more dopamine just to feel normal. And at the same time, the mama birds are like, they're getting all the worms they need. The brain actually decreases and stops making the dopamine on itself. And so this is why our brains develop this tolerance and dependence. So we need more and more to just feel normal. And at the same time, when we don't have it on board, we experience tremendous physical symptoms. So wrapping it up, addiction is a disease of the brain. It is chronic, and it is a neurobiologic condition. It is influenced by genetic factors, by social factors, by environmental factors. The brain of a person in an active state of addiction changes, and they experience compulsivity. That's the main key for understanding. And what then happens? One of the leading causes of death in the United States today is what? Everybody's seen it. Everybody knows. that overdose is one of the leading causes of death in the United States today. It's not because we have evil people, stupid people, bad people, broken people. It's because people develop a disease that, if not treated, will end up in death. So I want to take time for questions. Do we have?
We do have some questions.
We do have some questions.
Thank you so much,
You're
Dr.
welcome.
Dyben. The audience has come up with some questions, and we'll share them with you to get your thoughts on that. The
Let's
first
do it.
one is, how are we able to change our thoughts and behaviors?
How are we able to change? Oh, well, that's a really good one. So the key is that there is a link between the two. So our thoughts affect our actions, and our actions affect our thoughts, and we have to throw in feelings. So when you look at change, when we start by changing our actions, literally, when a person develops addiction, they come into detox, right? They need medical help to change those actions. But there is a constant tendency to feel like I need. The way you change it is through repetition of something else that you put in there. To simply say, what we tend to do when somebody's doing something that is harmful for themselves, we tend to say, stop doing that. Just stop doing that, right? And what I'd say is, do not think of the color red right now. Don't think about it. Your life depends on it. Right? Everybody just thought of the color red. So what we have to do is, through repetition, put something else in there. And this is where 12 steps become, and groups like AA and NA, socially supportive spiritual practices, groups like that. This is where addiction requires a multifaceted treatment that includes medication, that includes the social supports, but putting something else in place is critical. I don't know if that answers that.
That helps. What are some of the best practices for helping clients change their impulses?
So again, it is addiction. A lot of times when we talk about addiction, and we're actually going to talk about this next week, we're going to talk a lot more about the spiritual aspect of addiction. When we talk about spiritual, I'm not talking about religious. What I'm talking about is recognizing that we all have deeper needs than just our basic needs that we think of. Maslow had his hierarchy of needs, right? And he talked about the basic needs need to be met before higher needs can be met. And the reality is that may not be totally true. That actually our need for a sense of belonging, a sense of community, a sense of meaning, a sense of purpose, that these things can be almost just as important as some of our more basic needs. And so helping people get their basic needs while at the same time developing purpose and meaning. And we'll talk a lot more about how we do that next week too. I don't know if I'm allowed to
I think that's
plug.
Great. Yes, we definitely
we
want
plug that?
as
All right.
many people to join us next week as possible. So thank you. In your experience, what's the best way to strategically navigate stigma around addiction with families?
So the first thing is to step back and try to put yourself in the family's shoes. On the one hand, we tend to I tend to see one extreme or the other, right? And it's either blaming the family, or it's blaming the person with addiction, or it's pointing the finger and blaming people who don't like the person with addiction. The reality is this: if I care about somebody who has this disease, that's a pain. I'm having pain because that person's disease is causing them, when I want them to love me, when I want them to focus on me, when I want to focus on a relationship or our family or something like that, it robs them of their ability. And so my experience is that they neglect me, that they lie to me, that they make promises and they don't keep them. And I think, first of all, we have to be, when people have a negative belief about people with addiction, I think first we have to step back and say, oh, that's not because you're a bad person, right? Mm-hmm. You have the stigma you have because you've either gotten wrong messages or because you've been hurt yourself. And so I think people who have stigma, we need to have mercy there too. Then it's education. And I think education and helping people understand what's really happening. I work with family members all the time, and I can tell you that just learning about this and understanding what's been happening, understanding, man, my dad didn't reject me for the bottle, but he got captured by the bottle. And it's sad and it's hard, but education is key. And I also think that advocacy is key. That's why I love the foundation, what you guys do. There is no question that societal stigma as a whole has a negative impact on, it kills people. It literally kills people. And so when we can be understanding and loving and caring and understand that person who has stigma, and also help them better understand what's really going on, and then advocacy for, in our culture in general. I think that multifaceted approach is necessary.
Absolutely.
I can talk a lot, people on Zoom and people out here. I can,
The talker.
Sorry.
Absolutely. Last question that we have so far. I'm checking still to see if more are coming in. You talked about addiction not being a choice. So why does our society get this understanding of addiction so wrong? So
I love that question. And we're going to go back to chronic illnesses. So people will say all sorts of things. And I'm going to say something, I'm going to repeat something that was said to me that's very offensive. I'm not going to swear, don't worry. But it's a very offensive thing, but it's important that I say it so that we really get a picture. So I was doing a radio interview, actually, and there was a time, there's a drug called naloxone, Narcan, and this drug has one purpose: to save the life of someone who's dying from opioid overdose. One purpose, that's it, that's all it does. If I were to take Narcan, it wouldn't have any effect on me, doesn't get you high, nothing like that. It has one thing, it saves lives. And right? People are dying by the tens of thousands of opioid overdose. And so Narcan became available without a prescription, over the counter. And it was very controversial. And so some people thought, well, this is just going to make people use drugs more, which is not true, by the way, but that's a whole other thing. But I was talking to, and it's funny, I did 10 radio interviews in a row, and they were in different radio stations along the country. And so you'd have some people that were really understanding and thought it was great, and other people thought it was, had problems with it. And one guy said this: if they're dumb enough to put a needle in their arm in the first place, we should just let them die. Now, that is a terribly offensive statement, but he's not the only one that thinks that, right? And so the question is, it goes back to the idea of chronic diseases, because there are people who will say they chose, right? They chose to use drugs, and if they didn't choose to use drugs, they wouldn't have this. The truth is, there is a behavioral component to addiction. But there is a behavioral component to every single chronic disease out there. And we talked about my mom's behavioral component when it came to type 2 diabetes. I guarantee you no one is saying, well, she didn't take care of herself, so she deserves that diabetes and doesn't deserve to get treatment anyway. Cancer. There's a prominent politician, and I heard him say, my mom developed cancer, mom smoked, 3 packs a day, and nobody's going to say, well, she gave herself the cancer, so it's her fault, so we're not, she doesn't deserve treatment. most chronic illnesses, heart disease, we can go on and on. In the United States, one of the biggest problems, medical problems that we have is obesity. 41% over the age of 55 have obesity, which causes all sorts of problems, including me, by the way. I know, shocker, but the reality is that's about my choices. And if I developed a medical or a health condition because of that, nobody's going to be saying, you don't deserve treatment. You don't even deserve to live, because had you just exercised and eaten right and taken care of it, then you wouldn't have developed this. The key for us is understanding that absolutely, if we didn't live in a substance using society, and if people never used alcohol or other drugs, we wouldn't develop addiction. And if we didn't have so many fast food restaurants and choose to eat at them, then we wouldn't have a lot of other diseases. Every disease has an element of some point someone made a choice somewhere. But no other disease do we treat with this idea that they therefore don't deserve even, not only decency, not only understand, but they don't even deserve to live. And so it's up to us to challenge that and to help people recognize that chronic illness is chronic illness. And the response to chronic illness should be good treatment.
Great answer.
Thank you.
Great answer.
I appreciate it.
That's all the questions that we have. Thank you, Dr. Dyben.
Thank you all.
Thank you, Origins. Thank you all for attending our first town hall discussion for 2022 Recovery Leadership Institute series. We are thrilled with all the participation tonight. Next week's town hall, thank you, Dr. Dyben. He'll be joining us again. The topic is a clinical exploration of spirituality in recovery. If you're attending online, please make sure to register now for the session using the link in the chat box or by emailing rli@hanleyfoundation.org. We hope to hear your thoughts and comments, so please check the chat box in your email for our survey link. Good night and see you next Wednesday.